Have you ever really thought about the tools used to protect our eyesight? We're about to venture into a world where cutting-edge science feels a whole lot like magic, the world of ophthalmology. We're going to uncover some of the most incredible, almost mythical-looking instruments that modern-day healers use to defend our most precious sense.
I mean, just look at these things. They can seem pretty intimidating, right? Almost like strange relics from some long-forgotten age. But every single one is a masterpiece of engineering, a highly specialized weapon in the ongoing battle against blindness. So let's open up this armory and take a look inside.
All right, here's our map for this journey. First, we'll meet the guardians of our vision. Then, we'll dive deep into their surgical arsenal and their incredibly precise instruments. After that, we'll check out the tools they use to find hidden problems, and we'll finish up by seeing the amazing art of restoration.
You know, every epic story has its heroes. And in this story, The Quest for Sight, there are two key figures wielding all these powerful tools. For our journey, let's call them the surgeon and the seer. So, who exactly are these keepers of sight? Well, first up, you've got the ophthalmologist. This is our surgeon mage. They're medical doctors who go through years and years of intense surgical training. They can treat any eye disease and perform mind-bogglingly complex operations. And then you have the optometrist, our seer. They're really on the front lines, the first person you go to for your eyes. They diagnose problems, figure out your prescription, and when they see a really tough case, they're the ones who refer you to the ophthalmologist.
Okay, now let's get into the surgeon's toolkit. This is where we find the really dramatic stuff. The blades, the scoops, and the hooks that are used to literally reshape and restore the human eye.
Look at how elegant and simple this thing is. This is the wire vectus. You see, when the lens in your eye gets clouded up by a cataract, think of it like a cursed fogging up a crystal ball, this delicate little loop is used to gently, well, snare it and lift it out. It clears the way for light to enter again. And we go from a delicate loop to this tiny, sharp-edged cup. This is a chalazion scoop. Its whole purpose is cleansing and purifying, but on a totally microscopic scale. It's designed to meticulously scrape away unwanted tissue to clear out blocked glands in your eyelid. Now here is a tool that just sounds powerful, the bone punch. And it is. For some complex surgeries, the actual bone around the eye socket needs to be reshaped. This instrument lets a surgeon carefully fracture and remove tiny pieces of bone with incredible control. It's a perfect example of brute force meeting pinpoint precision. This next tool, it has a very solemn, very serious job. This is the evisceration spoon. It's only used in the most severe cases of disease or trauma when an eye simply can't be saved. Its function is to remove the internal contents of the eyeball, which is an absolutely critical step to prevent more harm and prepare a patient for the restoration process.
Okay, so we've seen the power tools. Now we're going to shift gears from raw power to just exquisite control. These next instruments, they're for the true artists, the surgeons whose work is measured in fractions of a millimeter. This is what you could call the art of the unseen. And different jobs require different tools, right? Both of these are called speculums, and their job is to hold the eye open during a procedure. But that heavy, guarded one on the left, that's for when you need to keep everything, lashes included, out of the way. The lighter wire one on the right, though, that's for when you just need a lighter touch, giving you access without putting on too much pressure. You know, even a task that sounds as simple as holding a needle, well, it requires a whole family of specialized tools. For stitching tougher stuff like skin or muscle, surgeons need a really firm grip, from a heavy-duty holder like a silkox or the locking arugas. But what about stitching tissues inside the eye that are thinner than silk? That's a whole different ballgame. That job calls for the Barker's holder, a superfine spring-action tool that's more like an artist's brush than a pair of pliers. And speaking of delicate, check out these iris forceps. The iris, you know, the colored part of your eye, it is unbelievably fragile. These forceps have these itty-bitty teeth right at the tip, designed to get a firm but really gentle grip on that tissue without tearing or crushing it. The amount of finesse required is just astounding. All right, let's step out of the operating room and into the diagnostic chamber. This is the seer's domain. The tools here aren't for cutting or stitching. They're for seeing, for scrying into the living eye to find the hidden sources of trouble before they get out of hand. Which brings us to a really fascinating puzzle. Think about it. Your eye is a soft, delicate little globe filled with fluid. So,
how in the world do you measure the pressure inside it without, poking a hole in it?
Well, the answer is this absolutely ingenious device called a tonometer. It measures what's called intraocular pressure. And this is so important because if that pressure gets too high, it can slowly and silently crush the optic nerve that connects your eye to your brain. That damage is the signature of glaucoma, one of the main causes of irreversible blindness. So this tool, it's not just a measuring device. It's a guardian, a sentinel standing watch against a silent thief of sight.
And there are a couple of really clever ways they do this. One is contact tonometry, where a tiny, sterile probe gently touches the surface of your numbed eye. But you're probably way more familiar with the other kind, the non-contact or air puff tonometer. Yup, that's the one that uses a quick puff of air that always makes you jump.
Wow, now this looks like something straight out of a wizard's laboratory, doesn't it? This is a trial lens set, and it's basically a whole library of lenses. Each little piece of glass holds a different power, a different possible way of seeing the world. And through a process called subjective refraction, the seer, our optometrist, uses these to find the one perfect combination that snaps your world into sharp focus. And all of that leads to this, a ritual we are all familiar with. You sit behind that big, crazy-looking machine, the phoropter, and you stare at an eye chart. The doctor starts flipping lenses, asking that timeless question, which is better, 1 or 2? How about now, 1 or 2? With every answer you give, you're helping them navigate that entire library of lenses to find your unique key to perfect vision. And for our final chapter, we get to see what all this work leads to. Because what happens when a part of the eye is lost or just damaged beyond any repair? Well, that's when these keepers of sight turn to the ultimate act of restoration, the art of crafting anew. I mean, these are just modern marvels, the final enchantments in our story. After a cataract is taken out, a tiny clear prosthetic called an intraocular lens is implanted, almost magically restoring clear sight. And in those cases when an eye has to be removed, a beautifully crafted artificial eye can be fitted. It's a non-functional implant, but it restores appearance and brings back an incredible sense of wholeness to the patient. So all these instruments we've seen today, they're so much more than just tools. They're the real, physical results of centuries of human ingenuity, all pointed at one single crucial goal. From a simple steel scoop to a machine that uses a puff of air, they show how the quest to save our vision is this timeless blend of ancient craft and, well, modern magic.